initiative, we're really excited to share with you some of the high-level efforts that are going to be taking place and really focusing in on our Zero Suicide initiative. Next slide, please. So we know suicide is all too common in the United States and Ohio. Each year, Ohio loses between 12 and 1,500 of our citizens due to death by suicide. The cause of suicide and suicide attempts are complicated and diverse, both in those who attempt to take their lives and in society as a whole. We know there are proven actions that can prevent suicide, and we want to increase the frequency of these actions and make sure that they're being implemented. Understanding the data behind deaths due to suicide can really help us appropriately target actions to save lives. Even modest reductions in the suicide rate in Ohio will result in hundreds of saved lives and thousands of years of productive life in those saved each year. Next slide, please. In 2016 and the 2017 state budgets, we were allocated funding to address suicide in Ohio. To our knowledge, we're only one of 5 states to specifically allocate funds for suicide prevention. By identifying suicide prevention as a major public health issue and disseminating strategies demonstrated to decrease suicide, we really have the opportunity to save lives and have fewer families, friends, schoolmates, and others impacted by this tragic event. We believe Ohio must adopt a data-driven, comprehensive public health approach to prevention of suicide and ensure that all Ohioans have access to effective, high-quality suicide prevention, intervention, treatment, and recovery support services. We know this is a massive undertaking, which we must approach methodically and logically using the best information available. And Ohio recognizes the quality work that is already taking place, and we really need to capitalize on the work by relying on all of our experts across the state that exist to reach the goal of suicide being a never event in our state. Next slide, please. So the department will be focused on evidence-based practices, policies, and procedures in order to enhance the suicide prevention infrastructure in Ohio and build the capacity of our behavioral health and primary health care workforces for maximum impact across the continuum of care and the lifespan of all Ohioans. So we're going to be looking at capacity building workforce development, stigma reduction efforts, helplines, which also include crisis text lines, and our stakeholder-led coordinated suicide prevention efforts. Next slide, please. So when it comes to capacity building and workforce development, the department is currently in the process of a needs assessment and gap analysis. The information compiled from this project will be presented to state and local stakeholders to help develop long-term strategies in reducing Ohio's suicide rate. It's the hope that the needs assessment and gap analysis will inform future workforce development needs, as well as support for specific evidence-based practices. The department will support opportunities for communities and clinical care settings to receive training and technical assistance on suicide prevention evidence-based practices. Those practices will have demonstrated a high return on investment and/or significant outcomes through either national or local evaluations. These evidence-based practice trainings will focus on primary prevention interventions and clinical care evidence-based practices that include interventions and treatment that are designed to target suicide risk directly, by directly targeting and treating suicide thoughts and behaviors. And at the heart of all of this is the Zero Suicide Initiative. Next slide, please. So Zero Suicide is a key concept of the 2012 National Strategy for Suicide Prevention. It's a priority of the National Alliance for Suicide Prevention and a project of the Suicide Prevention Resource Center. The foundational belief of Zero Suicide is that suicide deaths for individuals under care within health and behavioral health systems are preventable. Next slide, please. Zero Suicide approach for behavioral and physical healthcare systems represents a commitment to patient safety, the most fundamental responsibility of healthcare, and to the safety and support of the clinical staff who do the demanding work of treating and supporting suicidal patients. Next slide, please. The programmatic approach to zero suicide is based on the realization that suicidal individuals can often fall through cracks in a fragmented and sometimes distracted healthcare system. A systematic approach to quality improvement in these settings is both available and necessary. The challenge and implementation of a zero suicide approach cannot be borne solely by the practitioners providing clinical care. Zero suicide requires a system-wide approach to improve outcomes and close gaps. And Ohio Department of Mental Health and Addiction Services is committing to taking a system-wide approach to our suicide prevention efforts. So because of this, we will be sponsoring a series of zero suicide trainings in collaboration with the Suicide Prevention Resource Center for our clinical care providers and our behavioral health and primary care settings, as well as at federally qualified health centers. Next slide, please. According to Julia Goldstein-Grummett, Director of Prevention and Practice at the Suicide Prevention Resource Center, the zero suicide trainings grew out of a rising interest by healthcare organizations to learn how to provide better care for those at risk of suicide. The framework provides health and behavioral health care organizations with ways to improve care for those who are struggling with suicide ideation. Next slide, please. There are 7 organizational components to zero suicide. The first one is to lead. Organizations and leaderships must make an explicit commitment to reduce suicide deaths. Number 2 is to identify every person at risk for suicide. We want to make sure every new and existing client is screened and assessed for suicidal thoughts and behaviors. The next is engage. Engage clients in a suicide management plan and make a commitment to follow closely at-risk individuals for suicide by engaging and re-engaging them at every visit. Next is to treat. Treat suicidal thoughts and behaviors directly and choose evidence-based treatments that focus on the suicide risk to keep patients safe and help them thrive. Next, we have transition, and we want to follow patients through transition and care. Put policies into action that ensure safe handoffs among caregivers within the organization and upon discharge. And then finally is improve. Apply data-driven quality improvement. Use data to inform system changes that will lead to improved client outcomes and better care for those at risk. Next slide, please. The zero suicide trainings will be 2-day-long trainings. And as I said previously, they will be conducted by Suicide Prevention Resource Center for senior leaders of healthcare and behavioral healthcare organizations that seek to reduce the risk of suicide among clients in their care. The trainings provide information to participants on how to incorporate best and promising practices into their organizations and into their processes in order to improve care and safety for clients at risk for suicide. The trainings include interactive presentations and small group sessions, and the SPRC faculty will collaborate with participants to assist in the development of their specific zero suicide plans. Next slide, please. So currently our first academy is scheduled for April 12th and 13th in the Heartland and Appalachian Behavioral Healthcare region, followed by the Summit Behavioral Healthcare region in May. We're still working on internal finishing pieces, so we hope to have the future dates announced shortly as well. Each of these locations will offer slots for our behavioral healthcare hospitals as well. Next slide, please. And again, we're looking at targeting our behavioral healthcare providers, primary care providers, FQHCs. Organizations will need to identify 3 to 5 team members to attend the academy, and we will have national experts facilitating. Eligibility. There will be an application process for each academy. We are hoping to have the application for the April Academy released by the end of this week or the first of next week. But here are some pieces to think about as you consider applying. There's a cover sheet that will need to be completed. Letters of commitment from the organization's CEO or director is required. There's a one-page abstract and narrative, and within the application there's guidance and questions to help you develop that. And organizations must also complete the Zero Suicide self-study, which can be found on the Zero Suicide website. Preferences will be given to organizations that serve clients in areas of high risk and those within the behavioral health care region they are applying for. We suggest that you apply for the region that your organization falls within. Those organizations will get priority selection for that training academy. Selected organizations will receive a stipend in the amount of $8,000, and they will be required to participate in a 9-month learning community that will follow the training academies. So the learning communities will be funded and supported by the department, and we really want to develop this infrastructure with guidance through SPRC. The infrastructure will be developed to support organizations in the implementation of their zero suicide plans, and it will allow for interaction with other organizations to share experiences and further develop knowledge, skills, and abilities to sustain efforts across Ohio. Ohio's zero suicide mentors will also be identified, and we hope to provide opportunities to expand and support zero suicide efforts with the help of these mentors across Ohio. So as you can see, the learning communities will take place over a 9-month period. They will be 90-minute phone calls facilitated by SPRC staff. It allows for peer-to-peer learning. We'll have access to national liaisons, and some of the topics will include the implementation, data collection, electronic health records, process measures. And some of those pieces we'll start discussing in the academies, and that work will then carry into our learning communities. So at this time, I would like to see if there's any questions. Okay, so if there's no questions at this time, be on the lookout through Ohio Department of Mental Health and Addiction Services publications, the announcement of the application for the April training. My email address is at the end of the slide presentation. Feel free to email me with any questions you may have later. I'm happy to answer those, and we really look forward to seeing everybody at the academies. Thank you for taking your time today, and have a wonderful afternoon.